Best Cost is a Horizon Europe research project funded by the European Commission looking at the health costs of air and noise pollution. In our podcast, we talk with the researchers involved to learn more about how their work can build the evidence for stronger policy action on pollution. This episode, we are talking to Juanita Haagsma from ErasmusMC and João Vasco Santos from the University of Porto, and how pollution creates a greater health and cost burden on people, and how research can support evidence-based policy action. So welcome both. Thank you for joining me in this conversation. First, just want to hear from you who you are and what is it you do in your institution. So Juanita, if you want to go first.
Thanks, Eleanor, and thanks for inviting us on this podcast. I'm really excited to talk a little bit more about the Best Cost project. My name is Juanita Haagsma, and I'm an associate professor at the Department of Public Health at the Erasmus Medical Center in Rotterdam, the Netherlands. And my work focuses mainly on outcome measurement and burden of disease calculation. So in practice, that means that I'm involved in several research projects that investigate the impact of diseases and injuries and risk factors. For instance, I'm involved in projects on rare diseases, post-COVID conditions, or for instance, traumatic brain injury. And I'm looking at both the individual and population level for outcome measurements. And one of the projects that I'm involved in is, of course, Best Cost, where we're looking at stressors or environmental risk factors. And looking at both air pollution and noise, and also health inequalities.
Yes, very important, and welcome. Thank you for joining us. And João, would you tell us a little bit about yourself and your work too?
Sure, happy to do it. I'm João Vasco Santos, a professor and researcher on health economics and health systems at University of Porto. My background is also of public health medical doctor. And basically, I've been working particularly on health valuation recently, so that basically policymakers can actually make better informed based decisions about where to invest also across sectors, including on environmental policy. So within Best Cost, basically my team is leading to work on health monetization. So we are basically asking what is the actual value in economic terms of the reduction of air pollution or noise on health. So we've been preparing surveys across several European countries, but I believe that we'll be talking about these in this podcast, but I'm happy to share a bit more about that later.
Amazing. Yeah, we are going to get really stuck into these methodologies that you've both been leading on. But first, I wanted to ask you both, as we know, Best Cost is looking at air and noise pollution. So why are these two environmental stresses important to address together?
Yeah, shall I start with this, and then maybe João can allude. So both the air and noise pollution are the most common environmental stresses in urban life, and they often come from the same source and affect the same population. So that means that you have a lot of overlapping exposure and also a lot of overlapping health problems coming from the exposure to both. And it's important to look at them together, because if you look at policies, you want to look at policies that also affect both. So you don't study these risk factors solely to only focus on one of those. So you want to look at them together. Because both, like the noise and air pollutant, they both stem from human activities, like for instance transport or urbanization. And for instance, if you live near a road, you are probably exposed to both the air pollutants like particulate matter or NO2, and also the noise from the road traffic. So then you have this combined exposure. Same as with airports, for instance, or railways, where you also have the air pollutants coming from the exposure or from the traffic, and also, of course, the noise. You want to, usually they have the same effects or related effects, and maybe João can help me with this because you have more medical background. But for air pollution, for instance, you have the effect through inhalation of the particulate matter or other particles, which may cause cardiovascular disease or respiratory diseases like asthma. And for noise pollution, it's more through a sort of stress system. It's more subtle. So you have these stress pathways, which may cause sleep disturbance or high annoyance, and also high blood pressure, and then also cause cardiovascular disease. So usually, if you have both exposures, both the air pollutants and noise, they can both have, for instance, these cardiovascular effects. And if you only look at one of those two, then you may underestimate the combined effects of these both stresses. But I don't know, João, if you want to add to this.
Yeah, I can add some things to these. So basically, indeed, as you're saying, like the sources are the same, right? But the ways that, and these are indeed both harmful to health, but the ways that these affect our body and our health are indeed differently. So air pollution mainly works like through physical and chemical pathways. So basically, you are talking about tiny particle and gases that enter the lungs and pass into the bloodstream and then trigger inflammation and oxidative stress. So then these contribute to the disease that Juanita was already mentioning, indeed, like cardiovascular disease, respiratory disease, and so on. While noise, on the other end, acts more like a chronic stressor. So even if you can get used to it psychologically, like our body does not. So our body reacts to noise, activates stress responses, raising hormones like cortisol, increasing heart rate and blood pressure, etc. And over the long term, of course, this increases again these diseases that Juanita was mentioning. And it's also super important to mention that, for instance, in the recently from the European Environmental Agency report, like road traffic, for instance, was the most widespread source of transport noise in Europe, so exposing more than 19 million people to levels above the EU threshold. So in terms of dimension, basically magnitude, we are talking about a lot. And yeah, just highlighting again on this thing that Juanita was also saying on these exposure don't happen in isolation, so they happen or they used to overlap to the same places and same people, and biologically they actually interact and potentially amplifying each other's effects.
Adding to that is maybe with prevention. So adding to what João just said, so if you target your intervention only on air pollution or only on noise, you may miss very important health benefits. So and maybe you design very ineffective interventions. So that's why it's also important to look at them both.
And what you mentioned earlier as well, in terms of like the locations that people might be more exposed to these sources. So it's very much dependent on, it could be where you're living, but also on people's jobs as well. So if they're working at airports and construction sites, they're more exposed to these. And this is, I'm assuming, some of the socioeconomic factors that we're looking at in best cost.
Yeah, so we're also looking at socioeconomic groups, people that are at higher risk or more vulnerable for or more exposed to noise and noise and air pollutants. And these are often, you know, people from a lower socioeconomic status. So they also usually already are more vulnerable to diseases because of other risk factors that are playing a role. So that's why it's also important to look at subgroups as well.
So best cost is looking at the environmental burden of disease. How does understanding this environmental burden of disease help us to measure the different socioeconomic impacts, and what have been best cost findings on this?
So yeah, first of all, what is environmental burden of disease? I think it's important to first talk about that. So environmental burden of disease is a way of estimating how illness and premature death in a population can be attributed to environmental exposures, like for instance, air pollution and noise that we were just talking about. Like, for instance, how many people become ill from exposure, how many people are dying at a very early age or earlier age than the life expectancy would expect. You would expect according to the life expectancy. And to express the non-fatal and the fatal consequences of exposure to air pollutants or any other environmental stressors, we can use disability-adjusted life years. And disability-adjusted life years are a summary measure of population health. So that means that we combine all these figures together to express or to calculate how many healthy years are lost because of attribution that are attributed to exposure to an environmental stressor. So it actually translates the invisible exposures from noise, from air pollutants, to something tangible, namely healthy years of life lost. And it's important to understand socioeconomic differences because it allows us to look beyond the average population impact, but we can actually calculate the burden of disease for people with low socioeconomic status or people living in certain areas. And if we know information about which area they live, we often also know which socioeconomic status they have or what the income level is. And then we know if there's exposure information for that area also, we can look at inequalities. So are people in certain areas more exposed and therefore also have more DALYs, more disability adjusted life years from it?
But when you say like healthy years, does this mean like years spent free from disease, or is there a specific definition of that?
Yeah, good that you're asking this, Eleanor, because I talk about DALYs in my daily work a lot. So for me, it's very usual to talk about healthy years, but I realize not for everybody this is. Yeah, so that means that you're free from disease, you're living in full health, and also ideally you live until a very old age in full health. So that's healthy years.
Thank you for explaining that to me and to anybody else wondering. But yeah, and João, I don't know if there's anything you wanted to comment on that.
Just saying that indeed this is the start from our project, right? Like these DALYs, which is a super important measure for measuring health, and maybe spelling it like DALY for everyone to know how to write them. So these disability adjusted life years are indeed important to then actually for policymaking as well. For instance, from a health economics perspective, this burden of disease is a basic information for policymaking and for accounting for health. So before you can say this policy will save X euros, you first need to know this policy will prevent X DALYs. And basically, indeed, what we have been working is to on the translation of these prevented DALYs into economic terms. So a figure that indeed like governments and public budget planners can then decide where to put public money on. And this is obviously particularly relevant for policymaking, particularly, but even more particularly, I'd say, in topics such as environmental investments, because these environmental investments or policies need certainly a cross-sectoral approach. So while we can intervene in the health sector and remain, like for instance, in a particular hospital or a particular equipment and just stay within health sector, in environmental policies we cannot. So in that case, we really need a cross-sectoral approach, and that's why we go to this translation between prevented DALYs to economic terms.
Yes, and maybe talking about the economic terms is a good segue to go into the research, the methodologies that you're working on, João, as well. So your team are looking at cost monetization research and the cost of pollution. So like, how can understanding the cost of pollution through using cost monetization research is going to help us to design policies to address the socioeconomic inequalities of the health impacts?
So I'd first like to highlight that we should be talking about health monetization, so kind of monetizing health. We use costs, but we also use this health monetization. So one thing is costs and the other thing is health monetization. Or in this particular case, we are talking about averted, so kind of avoided disability monetization, not particularly only health monetization, which is basically, it's this not entirely the same thing, but it's similar to this inverted thing on like health promotion versus disease prevention, right? So there is a kind of an inverse correlation between disease and health, and that would be a lot of food for other discussions on what is a disease and what is health and so on. Although we are obviously tackling it in the best cost project, so we can indeed monetize it. So while, for instance, researchers and public health institutions speak in terms of DALYs and relative risks in order to make these cross-sectoral investments, for policymakers actually often speak in euros and often speak in investments, often speak on cost-benefit analysis and things like that. And monetization is the bridge between these two languages, roughly. So the basic idea is that, let's suppose that a new clean air policy will prevent 10,000 years of healthy life years of DALYs from being lost across Europe. So obviously that's a meaningful number, but then policymakers need to account for other areas besides health, like environmental outputs, other economic impacts, policy implementation costs. and also obviously for social and distributional impact. So in order to answer that, we need to express these $10,000 into monetary terms. And the question that is behind is like how much the society is willing to pay to prevent 1 year of healthy life lost, or 1 year in this case of disability adjusted life year, which is these dollars. So it's a very technical thing. So, but at the same time, it's also practical, because when you are defining policies, again, while in health you are basically using these dollars or similar approaches like quality of life and so on, when we are merging these different sectors, you need to use a cost-benefit analysis, meaning that you have to have both costs and benefits in monetary terms, so in money. And it's always a challenging and also ethical discussion, by the way. But we are actually using these on our daily basis, and of course, on our daily basis, I mean policy making wise. When you think about environmental policies, food safety policies, we are always translating health into monetary terms.
Very technical, is very interesting. And I mean, things we were saying as well, maybe for some people it might sound a bit overwhelming, the idea of like putting a price, so to speak, this is a bad way of phrasing it, but a price, so to speak, on like health and environment. But actually what you said, people's willingness to pay, it's also perhaps able to cater policy, using this to cater policy to what is it that people want and what is it they need, rather than just assuming like this is what they think.
Yeah, yeah, indeed. That's basically, there are actually different ways of putting a value into health. So there are different options. One of the most used ones, also for instance, in terms of investment on medicines, like whether to reimburse or invest on medicines is actually having a definition of threshold on will we invest on this medicine or will we invest on another medicine, and this threshold is indeed based on this willingness to pay from the society or the societal perspective. So that's basically it. And in this project, our team at University of Porto, but also together with other partners like including Juanita with us today, we are basically improving these methods by accounting not only for mortality, not only for premature mortality, but also the disability itself and the different levels of disability, because everyone, like people, including of course ourselves, value different types of health and value differently at least different disabilities and different disability levels. And we are doing this basically using a large-scale survey across some European Union countries and asking directly to citizens what is their willingness to pay for a health improvement.
Yes, and as we know, you're currently working on these surveys for best cost. And so the results are to come at the time of speaking, recording this podcast. But is there anything that you're like hoping to find, so to speak, or anything maybe you're expecting to come out so you think will be interesting that you can talk about right now?
So I've been involved. I must say I've been involved in several discussions and expert groups on health valuation, and there is a lot of research that needs to be done to better inform policy making. And obviously, policymakers need to have like strong foundations for the decision making. So basically, when I'm deciding whether I'll be investing on A or B, it's a huge decision. We are using a lot of everyone's money. And for that, I preferably use like real informed-based methods, and that's what we are building in. So, like I think that's something that triggers a bit from my side to work on these. So I think that we are still so far from what would be a good solution in terms of economic evaluations for policy making that we really need these kind of projects to not have an idea, but actually to put numbers there that so then we can actually use these values into policy making.
Great.
And I think adding to that, João, is that you're not only going to use these values in best cost, right? They can be used in many future projects. So it's not only an investment now for best cost and for the case studies that we're doing in best cost, but it's actually hopefully for many years people can use these values because they're not available at the moment, not at the detailed level that João was talking about. And it's actually quite difficult and to elicit these values from people, from the general population. You have to think about it, how you ask this question to get a meaningful answer and get a well-informed answer, an answer that the people who are actually filling out the surveys understand what they give an answer to. So it's a very complex task, and I think João and his team are doing a great job. It's a big investment. I think it takes a lot of time now, but it's a big investment for future policy making as well.
And picking up on what you were saying, and thanks for that, Juanita, because indeed, while we are focusing in the Best Cost project on environmental stresses such as air pollution and noise for these economic evaluation, indeed, the results that will come out from the elicitation of these health valuation are indeed values that can be used for all the different diseases across also different stresses, different determinants of health or risk factors for disease, indeed.
Hopefully it's a bridge that will exist for a long time.
Hopefully, yes. And that's the thing, yeah, as you mentioned, like going across different environmental stresses, and this is also something that other researchers in Best Cost are looking towards, and we will also be discussing this in a next Best Cost podcast episode to look into how these things can go beyond just air and noise pollution. I wanted then to ask you both, because in few introductions, you're both covering a lot of different topics and areas and a lot of expertise. So I just want to ask you a bit more about like what is your own personal motivation behind these research areas that you're working on for Best Cost?
Shall I start? What really motivates me is actually we're creating methods to make invisible problems, the air pollutants, the noise, visible for policymakers, people from the general population, researchers. As João already pointed out, air pollution and noise, they affect millions of people every day. Often also unevenly distributed. So often some groups are more exposed to than other groups, and also bearing more brunt of diseases and death than other groups. And with these methodologies, we can actually hopefully make a difference and translate our methods into actual decision making, not only now but also in future.
And from my side, I can tell you that one thing is clear also from Juanita also kind of mentioned it. So it's a super technical and difficult challenge, methods-wise, research-wise. So it also pushes me to work more and more on these, because indeed it's a really challenge research-wise, but actually it has a really practical implication on everyone's lives and our actually daily lives. So because if you are really improving policy making, we are really improving everyone's lives at the very end, and it's not like a super far pathway from what we are actually doing up until improving people's lives. So it's already kind of close. So I've also already shared that there is still an important research gap. I think there is a clear practical gap that we need to prove in terms of policy making. But also on another level, I think I'm sure that something that also pushes me to do more on this topic is the recent steps backwards that we have been doing. For instance, recently the United States Environmental Agency have excluded health from environmental evaluations, meaning that the states are basically actually putting a zero attached to the health value, which is indeed some steps backwards. So this becomes even more important to tackle these kind of things, because we are not only thinking about things like investing in a hospital or so, like we are thinking about environmental, food safety, or other policies that are global concerns, so they don't actually have real borders. So we certainly need to work at a national level, or actually at a global level. So while, for instance, countries can have different perspectives on both health and policies, it's also super important that we can actually make a change by improving these methods and pushing more towards at least universal knowledge, not necessarily consensus, but at least universal knowledge for informed-based decision making.
And I think adding to that, and I think it's a really good point, João. But it's also that I hope with these methods we also contribute to credible and transparent methods for policy making. So policymakers need this evidence that is transparent and comparable across context, and that methods that stand up to scrutiny in case people don't believe it or they don't think the methods are correct. So hopefully we are also contributing to that with our research. So actually credibility of policy, credibility of the science underlying the policy.
Yeah, totally.
Yeah, it's hugely important, and I'm glad there's people on the case for this. I also like the idea of universal knowledge, not consensus. I think that is an important step as well. And yeah, I mean, these things we're talking about, air and noise pollution, as we know, it's impacting all around the world, but also just not even from birth to the end of our lives. It's also even before you were born. And so it's very important that these policies are in place for people to have a good life as much as possible. And the research methods that you've both been working on and developed are very nuanced and very complex. So I'm also guessing it's come with a fair few challenges for both of them. So if there's any of those that you maybe like to share with us, maybe the challenges that you felt this is a good learning curve that you had as well during the process.
I can jump in on these because I wouldn't say it's only a learning through the project, but a learning that I've kind of have been testifying across this work that we have been doing is that it's incredible how the gap is still there. Actually not being humble at this stage, I feel that I'm getting myself more and more as an expert on these because I'm now figuring out how the different sectors completely speak different languages and not always, but often only understand the methods that each sector is actually working. And then these cross-sectoral policies that certainly need at least cross-sectoral common methods. When we are actually applying these to policy making, it's crazy that the research gap and the practical gaps are really there. So it feels like a niche, and suddenly you kind of become an expert because you kind of know the different sectors' methods, and they kind of know what we are talking about on everything on the health valuation thing. And yeah, I think that's something that I've learned throughout this path. And suddenly, just sharing that it has been a lot of understanding, a lot of studying as well, but also there is a clear need to improve the methods, and then a clear need to disseminate these methods, but also making them practically with governments, with international agencies, at a local level also, so they can indeed be practical, but we are still not already ready for everything. Things are happening, of course, evaluations are happening. Some countries are slightly ahead of others, but there are still a lot of things to do.
It's a great answer, João. I don't know if I can add to that, but yeah, for me, one of the main challenges João already alluded to this, that it's such a complex project with such complex factors included. And for me, the main challenge was dealing with this complexity without losing the clarity on what we're doing and why we're doing this, because we're starting to combine air pollution, noise pollution, health outcomes, socioeconomic factors, also the socioeconomic cost, and it becomes very complex very quickly. And each data source has its own uncertainties and assumptions. So very much trying to keep the clarity and the scientific robustness, and I think also balancing ambition with realism. So we want to have 100%, but sometimes that's just not possible. So sometimes you also have to just balance it a little bit with realism, what we are able to do in the time that we have with the people that we have and the data sources that we have.
And as you said before as well, it's not just about what Vasco is producing now, but hopefully the things in Vasco can be used in the future and long lasting, and that's very important as well. And then also just wanted to ask you about the personal highlights for you during this Vasco project, if there's anything you want to give a shout out to.
Well, for me, the biggest highlight was to actually collaborate with such a large group of very, very ambitious and smart people on this project, all with different backgrounds and different expertises, and bringing together all this expertise to understand environmental health. So that was really a big plus or big highlight for me. And also working with a lot of new people that I didn't know before, working on this project. So that's also always nice to meet new people and learn about their expertise and vision also on the topic.
Yeah, and on my side, I think that my personal highlight will certainly be on. Actually, it's personal, but it's not necessarily personal because I think that these results that we'll get, so we are building on these surveys that I was sharing, but these results that we'll have, I think they won't be, I would say, game changing, but they will be kind of game changing. So I really think that we are doing something that is really important for the society. So I think that in terms of a real highlight will be actually when you have the results and we'll not disseminate necessarily in terms of wording, but actually we'll start reusing them on our everyday policies. I think that will be my personal highlight within maybe, I don't know, some months or a year or something like that.
Thank you for listening to this episode on the science behind the health costs of pollution from the Best Costs podcast. To learn more about the project, visit best-cost.eu or find us on LinkedIn.